Hello, my support fibro friends. Hello, hello. Have I missed you? Just testing it live. So hopefully this works in our new location. We made it to Arizona. I made it to nursing school. I survived my first 2 weeks. So I'm here going through, and I just wanted to check in with all of you. I know it's been a time period, a gap between these live streams. So we're getting settled and we'll have more. I wanted to just share an update with all of you on some news, fibromyalgia news updates. It's actually September. I cannot believe it's the first day of September, and it's Pain Awareness Month. So we'll be sharing a lot of content on chronic pain from our friends out there and creating other content as well. And that's a big mission of why I decided to go back to school and nursing school, so I can have a seat and help at the table at chronic pain management, because it's been challenging as a patient advocate and even as a health coach to not be able to get a seat at the table when it comes to these chronic pain conversations. So I'm crossing my fingers that as a nurse, this is a master's program, and I'll be able to get a master's degree in nursing and then take the NCLEX exam to become an RN. So I'm crossing my fingers after completion and getting that degree, I will be able to get a better seat at the table when it comes to conversations about chronic pain. And it's really important. This is my mission. This is why I'm going back to school. And yes, I did survive the first 2 weeks. It's intense. This is an accelerated program, and I'm concerned with a lot of standing. I had a lab that started on Wednesday from 7 a.m., goes to 3 p.m. We're going to start clinicals, I think, in our 7th week on assignment. So I am nervous, but I'm also excited because I'm mission focused to help the fibromyalgia community. I know why I'm there, and that is a driving force for what I'm about to do. But I just wanted to check in with everybody. I know I need to get into a better rhythm. We're currently hopping around at Airbnbs right now in the state of Arizona near school, so I'm not going to be settled for a while, and hopefully with the internet connection, it'll be reliable. If I do cut out on this broadcast for some reason, I will do recordings of some of the content and news updates that I can follow up with. But I did want to just share some news with you. So I prepared a quick slide deck for everybody here on just engaging on what's new and some updates of news, things that you need to know, other companies that are helping the fibromyalgia community or chronic illness communities through telehealth. I do want to get a newsletter out shortly as well. So here's some updates besides the fact that it is the first day of Pain Awareness Month. So we will be sharing some more chronic pain content your way. Stay tuned on social media and our other channels. Retreat Migraine is actually on September 21st. It's free to register, so please do so. And it's all virtual online. I'm going to post the link right here in the chat so you can register if you're tuning in. And I hope that this is broadcasting on the internet to our friends both all over. So we're just testing again, getting back to it. But there's a link, and hopefully when I go back in, I'll edit and make sure all the hyperlinks are included. But Retreat Migraine is going to be a wonderful event full of connection with other chronic illness advocates as well. So again, it's free, it's virtual to register. We have some big news when it comes to epigenetics, and many of you know that I've been keeping up with what has been going on. So they have finally sort of settled this lawsuit, and I'm going to actually go into this. I'm going to skip ahead into the deck and come back to this because I know I tend to have a soapbox moment because this particular situation has really, really upset me overall. And even learning right now in my nursing classes, we have a code of ethics that we need to follow, and it's all about do no harm. So it baffles me to the extent that this medical provider didn't provide didn't apply ethics and falsified information for over 10 years to the fibromyalgia community, falsified claims and got away with it, made a lot of money off the fibromyalgia community, and they were ethically okay with that as a medical doctor. So let me return to that. Let me skip ahead because, again, you can see how fiery I get about this. And I'm glad that there is has been a settlement. There's some accountability. I don't feel like it's enough. And I'm hoping some other public health institutions will get involved. But this is huge to share. Please share around the internet because there's a lot of misinformation about this particular test. And people were very upset because they felt that it was very legitimate, where there's a lot of false claims. So I'm going to come back to this in a second. But I'm excited about this new telehealth group called Ravel Health. Now, the reason I'm really excited to just share this with you is I came across them. They do specialize. They're starting out with Lyme disease. They have a wealth of knowledge and providers that are trained heavily in understanding Lyme disease, but they also list fibromyalgia and other conditions on their website. And this is good news for multiple reasons. You can keep your primary care health physician, but what you do is you get specialized care through telehealth medicine with medical providers that are familiar with complex conditions. And the great thing about being familiar with a broad range of complex conditions like Lyme disease, fibromyalgia, ME/CFS, long COVID, EDS, and other complication mycotoxin exposures is they can figure out the root cause of what is going on with your health. Because sometimes there's a lot going on, even if you have the diagnosis of fibromyalgia, some of these other conditions get missed. So I like the fact that there is a company now available for you, and it's exciting. And so just to let you know, I will be posting links to all of this content, tagging them. There'll be more blog posts about Ravel shortly, because this is in addition to community. So they specialize in affordable virtual care for Lyme, mold, and complex chronic illness conditions. The company is founded by 2 chronic Lyme patients who were very frustrated with the process of finding treatment for Lyme disease and all the available options. So what they aim to do at this company is to simplify the Lyme journey from start to finish. There's no medical gaslighting or saying it's all in your head, no wait lists to see actual vetted Lyme literate providers. So if you're kind of on the fence or you haven't done enough detective work, because Lyme disease is much more prevalent than we even know, and I'm excited to connect with some other advocates who I definitely have been waiting for interviews on and we need to bring on, just so people can get more understanding of what Lyme disease is all about, what testing is available, and how to look for it when it comes to a lot of symptoms. Because a lot of these conditions have a lot of overlapping symptoms. It's very confusing. And I also like Ravel because they incorporate functional and integrative treatment options, but they don't forget the conventional. So they have different tracks that you can use based on what you need. There's monthly appointments available, and they have monthly memberships so you can upgrade, downgrade based on what you need. And they also give significant discounts on labs and supplements. Currently, they are live in 10 different states. But they plan to be nationwide by the end of 2025. So we are going to be posting a lot more information for you and putting blogs. We'll include it in our next newsletter as well. So keep posted for them, follow their social media accounts. I'm really excited about what they're driving ahead to do. Another telehealth company that you've heard us mention about is Swing Care. Now, just special announcement for them because they have expanded into Missouri and Ohio. So take a look at swing.care. Again, we will add all these links for you to find them. Specialized in fibromyalgia care, medication management. All the healthcare providers are trained in understanding fibromyalgia. I've joined a specific Facebook group with other patients that are part of the Swing Care system. And many of them have, it's been overly positive, and they actually have been enjoying the Stanza app. They really like the care that they're getting because it feels good that you're actually working with a medical physician and other healthcare providers that understand fibromyalgia. So I love the fact that they're expanding in other states. They are working with insurance providers so you can get coverage. And please support organizations like this, because the more we do, the more we can expand and have more services for fibromyalgia. And it's really important that we have doctors that have an understanding of specifics with fibromyalgia and that are willing to work with you on things like medication management, which is huge. You can have conversations. They have other ideas of how to care for fibromyalgia. So that's a huge difference. So that's why we support companies like this, because expansion, especially in telehealth, if you can get a specialist on, via telehealth, then that is important because you don't have to necessarily drive across the country to find a specialist that understands fibromyalgia. So you can keep your primary care, and then you can find a specialist that understands fibromyalgia and use it virtually, get what you need. They can work with your primary care as well to get you what you need locally and the rest of the healthcare team. So it's definitely an important piece of the puzzle. Okay, so now I'm going to go back because I'm going to go back to the epigenetics issue. So with the case settled here, I just want everybody to know, please spread the word because it's important. Again, we'll post a separate blog on this issue. So it is a settlement of the lawsuit. So they have to cease marketing and selling the FMA test. So that was the fibromyalgia test. I've heard about it since 2013, and a lot of falsified claims have been out there. And then there was the marketing of the 100 sure test. Nothing is 100%. And even the numbers were inflated based on what they were telling patients. And it changed a lot. So in the early, when it first arrived, it was more about maybe 93% was their claims. And then suddenly in some of their marketing, it went up to 98%. And there's literature on the CSPI site, so you can see the lawsuit, you can read through it. They've documented a lot of examples of where this company went wrong to falsify this information. So all of this has been misleading for the fibromyalgia community, and some of the additional tests actually have been recently marketed to communities like ME/CFS, long COVID, or what they've called immune deficiency disease. And so this is a dangerous area because we really need to have responsible science. And so there has been a settlement. So these companies have agreed to limit their claims, even on their recent company development. So there's multiple companies that this particular individual has started. So you might not see epigenetics tied to it, but their other companies are listed, which just jumps around. And again, there's a lot of money. They made a lot of money in transitioning. So I personally don't feel it was the benefit of doing good based, again, on ethics training for the medical community. We have to abide by ethics of standards. And this is what I'm learning too in all my nursing classes. Again, do no harm. So there was a lot of harm that happened to the fibromyalgia community mentally, I guess, with all, even financially, because initially when this test came out, people had to pay out of pocket. And for some reason, the insurance started to cover it, which helped, I guess. They still made money off of that. But a lot of people then felt, well, if my insurance covers it, it must be a legitimate test. So the tragedy of that is there was a lot of false positives in the initial research. So they did look at RA and lupus using these cytokine profiles, and there was false positives. Pretty high deal, all things considered, because if you have lupus, you have organ damage. So you want to get that diagnosis as soon as possible before later in the stages of lupus. It's very damaging to the organ system. So the fact that people may have walked away thinking that they had a fibromyalgia diagnosis on that sheet conclusively, apparently, which was told to them, but may have actually had lupus and then did not get over to a rheumatologist or anything like care. So they thought that their symptoms were being explained as fibromyalgia. That is really dangerous. And the fact, you also see a lot of information now popping up on the internet because I think it was pushed down by the algorithm, since these companies pay a lot of money to be at the top of the algorithm. So now that they've kind of deleted a lot of their old press releases, which I have photocopies of it all, I tracked everything that they were doing with all their lies. You can see a lot of sort of criticism from other companies about this particular test now online. They're popping up more in the algorithm. So there was criticism out there. I think it was just funneled to the bottom of the algorithm when you do the Google search, unfortunately. And even the American Family Physician said that this wasn't a viable test. And I know with Medicare, and they called it fraud in 2021, so they stopped paying for it. But there's been some more studies to really look at the data, and just there was such an influx of pressure from this particular company and an investment of money to skew the data that it just wasn't enough to be conclusive for everything that they were claiming. And that in itself is really dangerous. So if you hear people talking about this particular blood test, please let them know that there has been this lawsuit. There is a settlement that came through this. So all these claims, and also be aware that this company is still offering a product. Read and understand this product. Please don't fall for the false claims that this product was from a special fibromyalgia test, because that never existed. I've heard from some patients that flew all the way out to California only to find an abandoned building. So at these addresses, there were multiple addresses being shared for a very long time. And I even drove out to one years ago. I can never find a lab. So I think there's a lot more to this that we don't even know about. And this is only just, of a case on the false claims. And I hope maybe our public health agencies will do their due diligence and dive deeper into actually where all this data was going, where the money was going. Was there even lab work being done? I mean, you were getting a printout of your data, but I don't even know if there was a real legitimate lab when it came to this. Now, I'm just speculating. I don't have a lot of the information, but we do have information from the lawsuit itself. So thankfully, this is finally taken place and there's finally some accountability, but the harm that it created to our community, and even I don't even know what long lasting harm it's going to create for actually having science and reliable testing, because there may have been some truth to cytokine profiles, but when you understand these cytokine profiles, they're not unique to fibromyalgia. And just looking at only RA and lupus isn't enough, because as I mentioned, there's other factors like Lyme disease, there's other chronic illness conditions that have a lot of similar symptoms to fibromyalgia. And this is why we have to do a lot of detective work and really give a lot of education on some of these other conditions, especially like EDS, which is very confusing. Many of us have overlapping conditions. So how do we figure this out? So unfortunately, as a person who loves my science, this is really harmful to actually have this going on, especially when we are trying to work really hard to get legitimate tests for fibromyalgia, legitimate science that shows more diagnostic ideas of what is actually happening. We need more money investment in research. So companies like this, it's just not helpful down the line. And I think it definitely hurts other companies who may actually be able to show some diagnostic markers based on their research, because there are companies looking at this for lupus. And I know they wanted to open up something for fibromyalgia because they have a database already available to maybe try to look at some differentials. But this hurts us all around, and it's hurt our community too. I'm very sad and really upset for how long this was allowed to take place. So we'll definitely posting more information on this, but help spread the word, because I still see it circulated in Reddit, like Facebook groups, all over the internet. There's still information about this, even bloggers. And it's just like, why aren't you telling people what actually is happening with this and the falsified claims? I did actually see a research study on someone that criticized the science behind it and actually said it was much less. You're looking at maybe more, you're around like 70% reliability when compared to RA or lupus, but it does not distinguish between other conditions. So we really need to spread this around so people don't get duped. And I know some spam sites out there with fibromyalgia, what they do is they actually repurpose old articles. They make it look like it's new, and then they send it around social media so everybody shares, but it makes it sound like there's new research when it's actually not. So this has not been a new blood test at all. I first heard about it, I believe, in I think it was 2013. It's been a long time. I maybe even like later than that. But just so you're aware of what's going on, it's just important to have the information. So finally, there's accountability. I know insurance covered it, so I don't know what the consequences is for that. It is actually now medically unnecessary test. So a lot of companies will not do it, but luckily they will not be marketing and selling the test any further. We do hope to push for better research to find better diagnostic criteria for us all. So those are things that we are going to be working on moving forward. I just wanted to end to just talk about one thing that I've been working on personally, and I'm going to be posting some content too, is mindfulness, sort of meditation before bed. I've been trying to be more mindful as far as being in school. I noticed I'm not doing a great job with mindful eating, and with mindful eating, it's not scarfing down your food, but stress of school has created a lot. So I noticed the other day I was like really scarfing down my food very fast. So I'm going to be posting some content in the next few days, hopefully, just to get started with more mindfulness, and especially how you can sleep better. Because I know I struggle with racing thoughts, especially right now because we're moving, we're trying to find spots. We're moving from Airbnbs. I'm trying to study. I have a lot of deadlines, 6 classes, and trying to make things work. So some of the things that you can do, practice mindfulness meditation before you get ready for bed. So you could meditate before you brush your teeth, after shutting off your phone or computer, because these devices late at night are known to have an effect on your sleep quality, or even doing some mindful meditation before you fall asleep. So it's, I challenge everyone to see if they can make mindfulness meditation part of your routine. If you have used mindfulness meditation or breathing exercises before, please leave a comment. Let us know. If you have a resource you like Insight Timer, Calm, or those types of apps, let us know what you like to use, because I'm going to need everything. I'm going to have to try everything again and then some to get myself through school, and I'm sure for other people as well. Let me know too how it helps you with your pain, because I know you still have a lot of pain, especially at night. It's really, really hard to go to sleep when you're in pain, and extreme pain. You have headaches, then you get worried, especially if you have stuff to do the next day. It just cycles through. So this is where mindfulness can interrupt some of those thoughts. So some of the things that I've been trying to do personally when I'm sleeping to manage the stress is, I just select a quiet place. So I'm trying to lie down comfortably, which is hard because you're trying to create awareness of how you're feeling. I'm working on relaxing my body. I do focus inward. So I take several deep breaths and I pay attention to just how my body feels with each breath. And I'm going to have more videos on understanding breath work, because I know I tend to breathe really fast. And you could probably hear it in this live too. Different people in different chronic pain situations, you may not breathe enough. Like you may hold your breath because of all the pain, so you're holding tight, or you just be like breathing too much. And we're learning a lot about oxygen intake, and especially if you've been watching Dr. Jared Younger's videos, talking about the lack of oxygen within some of the patients. So this is something that's really interesting. So if you're just breathing and hyperventilating, like I tend to do, especially from the chest, it's like constantly, I'm trying to work on more like deeper, slow my breath, and also recognize when I have anxiety, because I'm really anxious, my breath changes, and I have to really check in with myself and ask myself, how am I breathing? And be like, okay, I need to calm down. Like, I need to take some deep breaths. I was like that at the supermarket too the other day. So just like, it's tough. And so just try to see what you can do to relax, be more anchored to the earth. Some people like grounding exercises. So going outside with the bare feet on the grass, if you can, Although right now I'm in Arizona, it is hot. It is very, very hot. So it's challenging. And then also if you consider any visualization, which I love actually is using more visualization exercises, because meditation, I know some people think you're supposed to clear your mind, but that's not exactly accurate. So I like things like visualization exercise. So maybe like finding a location visually when I close my eyes that makes me particular happy sensations. Like I really miss my dog Toby, but I put myself in a happy place of just snuggling with him, remembering those sensations. But you could pick maybe a vacation spot you remember fondly, a place where something just good happened. Where is your safe space that feels good? And take yourself there. Just breathe and let thoughts flow out. If you have any anxious or worried thoughts, let each occurrence be an opportunity to kind of observe those thoughts and just let it go. So sometimes we just breathe in good, let go of that stress, and you can visually do those types of exercises when it comes to breathing exercises rather than fighting the thoughts like many of us do. So it's always just about bringing attention back to breath. And I do want to do more interviews in the future with people that are really well trained in this. As a health coach, I know that I was really working on trying to do this, but I was surrounded. There was one particular health coach that I worked with, and he would do these amazing meditations for our group. Like it was so calming. I was impressed. So hopefully I'm going to reach out to see if he's available to maybe do some of those for us, or just invite some other interviewers, like people to interview to talk about this and other content. Speaking of which, if there's particular content you want to learn about, let us know so we can invite guests back. Again, I'm trying to get into a rhythm, trying to get good internet so we can do more interviews with people. I know there's been a list of people that are waiting for me to reach out to for interviews. I promise I haven't forgotten about you. So definitely stay tuned. I do want to talk about things like LDN. I did actually get a prescription from the Ageless RX to start LDN. So I started that in May. I'm not exactly sure if it's working at this point. I'm not at the highest dosage anyway, but it may be working to help me get through. So it's interesting. So if anyone's on LDN, definitely share your feedback. It's something that I'm trying to learn more about. I hear great things from the community. So I finally decided to try it. So doing a lot to try to manage my own needs over here in Arizona, but I wanted to check in with everybody. I've missed all of you in this sort of marathon sprint to get into nursing school. So many of you know I had to finish prerequisites. I got admitted conditionally, and then I still had to finish prereqs, and then I had to do all the clinical stuff to get accepted. So it's been a race, but I'm in it. I did 2 weeks of nursing school already. I'm tired. There's going to be a lot of work. I'm learning a lot, but I think I can apply this to educational content for the nonprofit moving forward. So it's exciting times. I have to ditch the purple hair, unfortunately. So you're going to see some gray hair in there. No purple hair. I have to wear a uniform, and the code is regular natural hair. So I will be losing that, sadly. But again, I still wear fibromyalgia on my sleeve, in my heart, dedicated to helping the community once I survive this program and doing a lot of things. So I just need to graduate so I can be a force to reckon with when it comes to fibromyalgia. I want to change the discussion. I want to get in there. I think there's a lot of tools that have been overlooked for the fibromyalgia community. I'm worried about medication management. I see it. We need a lot more tools. We need a lot more training of healthcare professionals. So I just want to inspire more healthcare professionals that we can tackle fibromyalgia. Don't have to be afraid of it. So this is the process that I'm beginning to do. So let me just say hello to everybody while I can. Hi, Margaret. Thank you so much for tuning in. I appreciate it. I look forward to more content being posted. Danielle, thank you so much. So Danielle was so amazing, and she gave me some avocado swag, which I'm using to its full extent. I got my avocado pens, my paper, my avocado little purse, which is in my backpack. So I've gone back to school fully. My textbooks are huge. I'm just glad I don't have to carry them on my backpack like old school ways. But Danielle, I appreciate you so much. So you made the start of nursing school so much easier with that avocado swag. And I remember it just is a good reminder to smile. And I'm going to have to enjoy the ride in the midst of all this stress. Mo, hello. It's so good to hear from you. I definitely need as much advice as I can on how to survive nursing school and what not to do as a nursing student once I end in clinicals. I don't want to be annoying. I know sometimes as students we're annoying when we enter the healthcare system. So hopefully I don't make those mistakes, but I will be. I think we get first assigned our first semester at an assisted living facility. And then we're going to move to different areas. We do community health, med surge. I'm really nervous about being placed in the ER in some ways, but you never know. Maybe I'll be able to help with chronic pain management. I've noticed there is a lot of stigma with chronic pain management in the textbooks and some of the people I've already talked to who have experience. I'm fascinated to dig in. I know there's a lot of emphasis on substance abuse versus pain management. So I'm interested to see what people are actually seeing in real life, where this stigma is coming from. We will be getting into pain management. So I'm going to have to just see what I can say and articulate through my classes. But it's important for me to be there and survive because I do understand what it's like to show up in an ER and be treated unfairly. And I just wanted help managing my pain. Been doing this since I was a teenager, and I didn't understand what was happening. So I would end up in the ER with I didn't know it was costochondritis. I just thought my chest was hurting so bad. I had just felt like I was, chest pain. I couldn't move my body. So I would end up in the ER. I wasn't treated really well. I was very confused as a teenager. So I've had a long history of adversity, and I don't want any of you to go through that. So it's a really big mission here. That's why I'm throwing myself into school. I think this might be the best option to get a little bit more attention from public health agencies and healthcare professionals. Been trying to do as much as I could as a patient advocate and as a health coach, but I've hit a barrier. So crossing my fingers again, this will all make a difference. Mo, yes, yoga music has helped. I know there's different forms of yoga, like to try. So these are things and conversations I want to have with specialists that are more trained in this. For LDN, so I used a company called Ageless Prescription RX. So they are available and they do a monthly prescription. You do talk to a medical provider before you order it. And so I wanted to try it. I'm going to admit all to you. So I've really struggled to find a primary care provider. I've always had specialists, or I've done consultations with specialists. So I haven't really found the healthcare team that I needed when I was in California. I'm hoping now in Arizona, it seems like a lot is opening up, and I'm excited. There's some new providers out here that I've always wanted to work with. So I'm excited to do that. I think I'm going to have to stick with naturopathic medicine, even though I'm training in allopathic. But I'm going to be looking for that. There's a great naturopathic school that I wanted to apply to, but I've been hearing that the NIH really wants you to understand allopathic medicine and if you want a seat at the table. So we're doing this first. But the school there, I think, has a clinic. So I'm going to go check it out too. I know I was disappointed I didn't go that direction because I think that would be more friendly for my skill set. But this is the road I chose. There's a lot of opportunities moving forward. I just got to survive. But I don't know. I heard great things about LDN. I do want to post more blogs, get more interviews. During the conference, we did have a medical doctor that spoke about it from South Carolina. So just getting more information. But again, if you have used LDN, please let us know. And if you've been getting your prescription through Ageless RX, and I'll post links so that you can access. Again, it was talking to a medical professional to get the prescription. And I've responded pretty well. I know naturopathic doctors, depending on your state, can get you a prescription of LDN. I believe Swing Care, because Dr. Chadwick does talk about LDN, could offer that as a resource if they're available in your state. I'll have to do the full rundown because I think they are available. So that might be something to check out too, if your insurance covers it. Because LDN is generally LDN you have to pay out of pocket for, which is tough. So it's compounded, paid out of pocket. But so far, I mean, I've heard great things about Ageless, so that's why I looked into it, because it is available. It is marketed by the LDN Research Trust. So I just wanted to do the research on myself, be my own guinea pig when it comes to that. So I will definitely include all of that. And again, Mo, yeah, I definitely, again, if you have any advice for surviving nursing school, Mo, please let me know. Yeah, it's not regular doctors. It's not one of the FDA approved medications, but it is available, and there are medical providers that do end up getting you on LDN. So there are MDs. They usually have more concierge services. They don't take insurance. From what I've seen with people's comments and from other bloggers, it seems to work better with less side effects, potentially. Not everybody can handle it. So again, it's not a perfect system, and you titrate at a very slow rate. At least I'm doing it sometimes. And there's also, unfortunately, when you ask for doctors, they give you a really high prescription. So just a reminder, and we'll be posting information. It's low dose naltrexone, low dose. So even the capsules that I got were 0.5 milligrams to titrate up. They like you. The normal, I guess, from LDN Trust is to go up to 4, but I'm not there because I'm just waiting at a certain one. So, it's low dose. And I hear from patients, though, that they've been prescribed like very high dosages. That's not what this is about. So I will definitely keep everyone posted with blog and content and post. I'll add a description, LDN Research Trust, and they have a database of doctors that are familiar with LDN, who prescribe LDN, know how to work in it. Dr. Ginevra Lipton, she was a speaker at the LDN conference. So I know she's no longer seeing patients, but she does have videos on LDN. She has content there, but there were a lot of speakers. Dr. Nasha Winters is one of them, who's another naturopathic, but I think there are some other people who are MDs in different places. I think many of them have switched to concierge services, so paying out of pocket for doing this, but they have a lot of knowledge. There's books from the LDN Research Trust to learn more about the science of it. It's interesting. And even Dr. Younger has videos about LDN. He's been doing more research. I'll post that as well, because actually Dr. Mateus, who is in Covina, California, I never got a chance to see him. He's a rheumatologist, so he's an MD. He actually talks about LDN, and he's done research on the effectiveness. So he does prescribe it for fibromyalgia. So I'll include all of that for anyone out there. And oh no, what is that? So Dr. Chadwick doesn't see. Okay, well, that's news. Thanks, Mo. I'll have to ask them about that. She's listed maybe as a medical director, but not seeing patients. She has a research center. So I don't know. This is so unfortunate, because we need medical specialists that understand fibromyalgia. I did connect with a medical doctor in Colorado Springs. So I do want to have an interview with her. I'm excited, but man, a lot of these fibromyalgia, like when they specialize, they're no longer treating patients. This makes it challenging. So we are going to need more healthcare professionals to take an interest in this. And it just seems like it's much more valuable. I'm surprised by that statement and a little concerned again. So I thought she was actually treating patients. So we need to do more, and that's what we're actively doing. Medical training is huge. We're going to try to go back, hopefully all circumstances, to go back to ACR this year, and again, continue connecting with medical providers. We're working with some other stakeholders that are going to help us with connecting to medical providers. I'm hoping that I can say that as a nursing student, maybe it'll give me a little bit more time. That's the goal in understanding and with having trained in allopathic medicine. But if you are a nurse out there, like, I think we're probably going to have to join forces and create some sort of educational content I'm learning about organizational institutions right now and who creates the content for training. I'm learning that the nursing content is behind when it comes to fibromyalgia. It's very, very small. And again, it's very lopsided. So we need, maybe this is an opportunity to develop more education for nurses. Definitely see if we can tackle some NPs, so nurse practitioners moving forward, PAs, all that staff that's within the practice, especially primary care, to change the medical system. So that is really what's ahead. We have a lot of work to do, but we're starting it. So I'm going to definitely create more content. I'm probably going to try more shorts. I have to make time for this because it's important. All of you are important to me. I miss all of you. I know you're going to see all the gray hairs probably by the end of the year show up. We still want to have a conference. We may have to move it based on the fact that I'll have finals right in that December, November time, all my assessments, all my clinical assessments. But we do want to continue with constant creating of content. And for all of you out there, again, waiting on interviews, please, I have not forgotten about you. We're going to be creating content once I get settled. We're going to be jumping around from Airbnb till the end of the year, but hopefully all the internet lasts. Oh, this is good. Melissa says, my rheumatologist in Oklahoma prescribed it, but it was at a high dose. Okay, we'll see. This is good because, so I've been reading in the groups that some people are dissolving the high dose, but yes, they advocated for you to start at 0.5. So that's low dose. So again, there's a lot of misinformation for medical doctors, and we hope to work with like the LDN Research Trust to really understand what they mean by low dose naltrexone, because you can get a prescription of naltrexone at a high dose, but what we're talking about is the low dose. So I'm glad, you know, the compounded pharmacy. So rheumatologists are trying to prescribe it. So the word is getting out. It needs to go out further. There needs to be further training of LDN for fibromyalgia. And again, it's not perfect. Nothing is ever perfect. We don't have a perfect medicine at all. From what I've seen with accountability for some of the FDA-approved drugs, I am concerned. I think there needs to be more medication management overall. From just observing the groups, just clearly me observing, I'm not seeing as noticeable side effects when starting at low doses. Some people do. You may have an allergy or sensitivity to some of the ingredients. Some people get really hyper. So just be aware of some of these things you might notice. And also the issue with LDN that I've noticed, the low dose naltrexone, is that it can take a while for you to actually feel a difference. So you may not feel anything. And I do encourage you to look at Dr. Younger's information on this as well, because he really discusses the science of it. He's actually trying to look at the proper dosage to help with it, you know, because it's prescribed in different realms, not just fibromyalgia. They're looking at it for autoimmune conditions. You have to be careful if you have the thyroid autoimmune conditions. So there's a lot of information out here when it comes to managing inflammation, because they see this as something that can help with neuroinflammation, managing inflammation process. So he does have discussions. I'll include all of that. I need to post a blog. I was hoping for our name change. The IRS is taking way too long. But I'm working on a new website, on a new URL for everyone, but I'm just going to post it on Support Fibro, a blog of information, so you can read through a lot of the information with LDN. Again, I want to have more healthcare providers come on and create content for us to talk about it, but the LDN Research Trust is the go-to resource for that. They have a lot of interviews, they have YouTube channels, they have books, they have resources, they have conferences, they have a database of doctors who do prescribe it. So the word is getting out. And again, if you have used it and had success, or you used it and have not had success, please post when rewatching this. So I appreciate all of you. I will be back as soon as possible. So today we're moving into another Airbnb. Crossing fingers, internet is just as solid. So thank you to everybody for tuning in. I will keep you posted. We'll be posting on social media updates. I want to know what you want to hear about. I'm going to try to create more content related to what I'm learning in classes, because I'm going through pharmacology, pathophysiology, what else? Like aging. So what's going to help me to remember all this content fast is actually to regurgitate it in blogs and tie it into fibromyalgia. So I know that helped me with studying. I'm going to have assessments, I'm going to have tests, and I'm going to have to pass. So if there is particular content that I can help you with, I'm going to dial that in. So I appreciate all of you. And I'm seeing Melissa has LDN has helped some. Now, I'm curious to know, like, I want to hear from people too. How did you recognize it? Because I did reveal I started it in May. I don't know if it's helping yet, but it may actually be. The fact that I've been surviving what I've been surviving, and I was able to stand for as long as I was able to stand and had minimal amounts of pain, it might be actually due to that. I've been trying to keep up with my nutrition, but we'll have a load of content. Thank you again, everybody. Please have, I know it's, hopefully you have an extra day on Monday to rest and relax. I wish everybody definitely low pain days ahead, and I will be talking to everyone soon. Thank you so much. Stay nerdy and curious, and I definitely hang in there, everybody. Bye.